Ever feel like you're just drowning in acronyms and different organizations when you look at healthcare technology? Like just trying to figure out who does what?
Oh, absolutely. It's a common feeling. It's definitely a complex space.
Well, today we're going to try and cut through some of that noise. We're taking a deep dive into two really key areas.
That's right. First, the groups, both national and international, that are basically setting the rules for health information, the standards
The
bodies.
rule makers, yeah. And second, the really kind of exciting world of simulation in healthcare education, how tech is changing training.
Exactly. And we've got some great notes here covering, informatics standards, tech-based education, the whole lot.
So the mission really is to pull out the must-know info, make the landscape a bit clearer, and show you why this stuff actually matters in practice.
Let's get into it. Where should we start? The standards landscape.
Yeah, let's unpack that first. This whole complex world of organizations setting the rules for health information, it's all about making sure different systems can, like, talk to each other, right?
That's the core idea, interoperability. And nationally, in the U.S., a really big player you have to know is the ONC, the Office of the National Coordinator for Health Information Technology.
Okay, the ONC, so they're the main coordinators.
Think of them that way, yeah. They lead the charge on building the national health IT infrastructure. A huge focus is making sure different electronic health records can actually share data and promoting what they call meaningful use.
Meaningful use, like actually using the EHRs effectively.
Precisely. Not just having them, but using them to improve care. The ONC's work directly impacts how easily, say, your primary doctor can see test results from a hospital visit.
Right, makes sense. Okay, who else is key nationally? I see the ANA here, the American Nurses Association.
hmm People know the ANA for advocating for nurses, obviously, but they play a big role in informatics, too.
How so?
They define the specific informatics competencies nurses need. They have this key publication, Nursing Informatics, Scope and Standards of Practice.
Okay, so they set the bar for nurses using health IT.
Exactly. It's the foundational guide for nursing informatics skills and knowledge.
Got it. Then there's AHRQ, Agency for Healthcare Research and Quality. Sounds research focused.
It is. AHRQ is all about the evidence. They research how health IT impacts patient safety and quality of care.
So they figure out what actually works, best practices.
That's a good way to put it. They fund and conduct studies to make sure that the way we use technology in healthcare is actually, safe and effective,
Yeah.
making IT use evidence-based.
Okay. Now let's talk about regulations and money. That sounds like CMS territory centers for Medicare and Medicaid services.
Bingo. CMS holds significant power through regulations and reimbursement. How providers get paid?
So they can really drive adoption of technology.
Absolutely. They often link Medicare and Medicaid payments to things like using certified EHRs effectively and meeting certain quality measures that depend heavily on informatics.
Like MIKS, I see that mentioned.
Yeah, the merit-based incentive payment system is a prime example. It adjusts payments based on quality and value, and health IT performance is a big part of that. So CMS policies really shape how providers use technology.
Okay, powerful stuff. What about the National Library of Medicine, NLM? Sounds like where the dictionaries live.
In a way, yes. The NLM is absolutely fundamental. They're the stewards of vital medical terminology systems. Think UMLS, SNOMED CT, LOINC.
Those sound important. What do they actually do?
They provide the standardized language. SNOMED-CT is like this huge clinical dictionary. LOINC standardizes lab tests and observations. UMLS kind of maps between different terminologies.
So they allow different systems using different local terms to understand the same clinical concepts.
Exactly. It's the bedrock of making sure data is comparable and understandable across systems. Truly essential for interoperability.
Okay. And one more on the national-ish front, HL7 International, Health Level 7. Sounds techy.
It is. And it's crucial for the actual mechanics of data exchange. While it's international, HL7 has a massive footprint in the U.S.
They make the standards for how data moves between systems.
Yes. And their newer standard, FHIR, Fast Healthcare Interoperability Resources, is a really big deal.
FHIR. Why is it such a big deal?
Think of it like modern web standards, but for health data. It uses web technologies, APIs, making it much, much easier for systems, especially newer apps and tools, to exchange information compared to the older, more complex HL7 versions.
Okay, much more flexible. Got it. So that covers the main U.S. players. But healthcare is global. Who's setting standards internationally?
Right. Globally, a key player is ISO, the International Organization for Standardization. specifically their technical committee, TC215.
ISO TC215, what's their scope?
They develop global standards for health informatics, things like data privacy rules that work across borders, common terminologies, security protocols for international health data, really broad stuff.
Okay. And IMIA, International Medical Informatics Association.
IMIA is more about the people and the knowledge. They focus on fostering international collaboration in informatics research and education.
So connecting the global informatics community.
Exactly. And pushing for standardized curricula, defining core competencies for informatics professionals worldwide, building that global workforce.
Makes sense. And the WHO, the World Health Organization, must be involved too.
Definitely. The WHO shapes global e-health policy, works on international data governance frameworks, issues digital health guidelines.
For things like?
Like standards for sharing data during pandemics, tracking diseases across borders using digital tools, promoting best practices in public health informatics globally.
Very important. Okay, last one here. CENTC 251. That looks like a European thing.
It is. CEN is the European Committee for Standardization. TC 251 focuses specifically on health informatics standards for the EU.
So harmonizing things within Europe.
Yeah, things like ensuring EHRs across EU countries have consistent structures, strong security, and can exchange data smoothly between member states.
Okay, wow. That's quite a list of organizations. So let's connect the dots. Why does all the standardization stuff really matter? It sounds a bit, bureaucratic.
It can seem that way, but it's incredibly practical. Think about it. Without these standards, every hospital system, every clinic software might speak a totally different digital language.
Right. Chaos. Like needing a different adapter for every single electronic device.
Exactly. Information couldn't flow. Your doctor wouldn't easily get your history from another hospital. Researchers couldn't combine data from different places to find new insights.
And patient safety could be compromised if information is missing or misunderstood.
Absolutely. So these standards enable interoperability, that smooth data sharing, and ultimately support better, safer care for you. That's the real-world impact.
Okay, that makes the importance much clearer. Now, let's shift gears. This other area sounds really fascinating, using technology, specifically simulation in healthcare education.
Yeah, this is a really dynamic field. Simulation basically uses tech to create environments that mimic real healthcare scenarios.
So learners can practice without any risk to actual patients.
Precisely. It's about building skills, making decisions, even making mistakes in a totally safe, controlled setting.
One type mentioned is virtual worlds, like Second Life or OpenSim. That sounds almost like a game.
It has game-like elements, but it's serious education. These are immersive 3D digital environments. Learners use avatars to interact.
Avatars. So you could have a student nurse avatar talking to a patient avatar.
Exactly. Or a whole team of avatars, doctor, nurse, pharmacist, working together on a simulated emergency, like a Code Blue scenario.
Wow. What kind of skills does that help build?
All sorts. Patient communication, definitely. Team-based care coordination, practicing emergency protocols. It's very experiential.
So you learn by doing it, just virtually. What are the big upsides?
Well, that experiential learning in a zero-risk zone is huge. It's great for interprofessional training, getting different healthcare roles to practice working together, and it's really good for developing those softer skills like empathy and teamwork in an engaging way.
Okay. Then there are serious games. The name implies they're not just for fun.
Right. Games like Pulse, Code Blue, or various virtual patient platforms are designed specifically for education.
How do they work, typically?
Usually scenario-based. You're presented with a clinical challenge, you make decisions, and the scenario branches based on those choices. You often get immediate feedback and scores.
So it forces you to think actively and apply knowledge.
Exactly. It promotes active, problem-based learning. It's really good for reinforcing knowledge, honing clinical reasoning. And again, you can repeat difficult scenarios over and over without patient harm.
Makes sense. Now, when I think simulation, I often picture those really realistic mannequins, high-fidelity simulators.
That's right. Mannequin-based systems, like the Laerdal Simon, are a classic example. These aren't just static dummies.
No. What can they do?
Oh, they're incredibly sophisticated. They can breathe, have pulses, measurable blood pressure, react to medications, even speak pre-recorded phrases or have instructors speak through them. They simulate physiological responses realistically.
So you can practice things like CPR, giving meds, listening to lung sounds.
All of that, physical assessment, critical interventions, it feels very real, which is great for building hands-on skills and confidence.
And besides mannequins, there are also computer-based case scenarios, right? No physical component.
Correct. These are software simulations. They present complex patient cases using text, images, maybe video clips of patient interviews or test results.
And the goal there is more about.
Developing critical thinking and diagnostic skills. You have to analyze the information, decide on next steps, order tests, make diagnoses as the case evolves in the software, usually with feedback along the way.
Okay, so a whole range of tools. What does this all mean for you, the listener, trying to get a handle on how healthcare professionals learn these days?
It means learning is becoming much more active, immersive, and safe. Simulation offers this incredibly powerful way to build core competencies.
Competencies like assessment, decision making.
Yes, and teamwork, communication, procedural skills. It also really helps build confidence and reduce that anxiety learners feel when they first encounter real patients. Being able to make mistakes safely is huge.
And I imagine there's good data that comes out of these simulations for evaluation.
Absolutely. Most platforms have built-in metrics. You can track learner performance, see if they followed protocols, identify areas needing more practice. It provides objective feedback.
Plus, with online platforms, it seems more accessible too.
Definitely. It opens up high-quality training to remote learners, supports continuing education. Accessibility is a major benefit.
So wrapping this up then, we've kind of journeyed through two big, important areas today.
Yeah, first, that whole landscape of national and international groups defining the standards for health information, the essential rules of the road for health IT.
And second, this really diverse and growing world of simulation tools, virtual worlds, serious games, high-fidelity mannequins that are fundamentally changing how healthcare skills are taught and learned.
And both are just so crucial. The standards underpin everything related to connected, efficient healthcare and using data effectively.
While simulation builds safer, more competent, more confident healthcare professionals.
Couldn't have said it better. They really go hand in hand shaping the future of healthcare delivery and education.
So, here's something to think about as we finish. Both informatics standards and simulation tech are evolving incredibly fast. Considering that rapid change, what future innovations do you think will have the biggest impact on healthcare and learning down the road?
That's a great question. Lots of possibilities there. Definitely something for you, the listener, to mull over as you think about where all this is heading.
Well, thanks for joining us on this deep dive today, exploring these vital areas of health informatics standards and simulation.